Could HRT really lower your risk of dementia? We've heard so many conflicting things about HRT over the years. At times, we've been warned that hormone therapy, could increase the risk of dementia. But then we've also heard, on the other hand, some research suggesting that some types of hormone therapy might actually be beneficial for our brains. And now there's a new study that's suggesting that women who had used estrogen-only hormone therapy had a lower risk of dementia and fewer Alzheimer's-related changes in their brains. So what on earth is going on? Well, it turns out that HRT isn't one single treatment. And that distinction, it really does matter, because some women take estrogen on its own and others, they take estrogen with another hormone called progesterone. And researchers haven't always found the same results with those different types of treatment. One of the big studies over recent years raised concerns about HRT and dementia, and they found increased risk with the combined estrogen and progesterone therapy. But estrogen alone didn't show that same increase. So when you see a headline saying HRT and dementia, there's actually quite a lot hidden behind those words. And that's where this new study comes in. This wasn't a study where researchers recruited a group of women and gave half of them HRT and then the other half didn't have it to see what happened. No, they went back to existing health data from more than 21,000 women who had already taken part in 2 large US studies. And they looked at the data to see which women had reported taking hormone therapy and which hadn't. And when they saw what had happened to them over that period of time, what they found was that women who had used estrogen-only therapy had lower rates of dementia. And it didn't stop there. Some of the women had passed on. And so what the researchers did is they went to examine their brains as well. And so they looked at their brain tissue, examined the actual brain tissue, looking for changes that are associated with the Alzheimer's disease. And guess what? They found fewer of those Alzheimer's-related changes among women who had used only the estrogen version of therapy, of HRT. So we're not just looking at whether someone received a dementia diagnosis. For some women, the researchers could actually look at the brain tissue and see whether those Alzheimer's-related changes were there. And that really caught my attention. But, let's not get too far ahead of ourselves, because the researchers didn't decide that certain women would get HRT and certain people wouldn't. So we can't look at the results and say, taking estrogen caused these women to have less dementia. No. There may have been so many other differences between the women who used the hormone therapy and those who didn't. And that's one of the reasons you can get different answers from different types of research. And it also means we shouldn't take one headline about HRT and assume it applies to every person or every woman, because every type of HRT and every stage of menopause is different. Because even within HRT research, there are different hormones, there are different formulations, people take it at different ages, under different circumstances. So there's so many variables at play, but it doesn't mean that women shouldn't take estrogen. We just don't know whether it will really prevent Alzheimer's. But it does give us something else to think about when we talk about the relationship between menopause, hormones, and brain health. Because menopause happens decades before dementia generally develops. And you can see why researchers are interested in what happens to the brain and the body around this period of time, and whether those changes could have consequences much further down the road for us. Like I said, we don't have all the answers yet, but I think that this study, it gives us a good reason to stop and think, or to stop treating HRT and dementia as though it's one simple question. It's not. So when you see that headline next time, HRT lowers dementia risk, I would look a little bit further and I would ask, which HRT are we talking about? What women were involved and what did the researchers actually find? Because Those are the details that completely change the story. Thank you. Okay, I hope you enjoyed that. My name's Kat. I take the latest dementia research and I try and break it down into something that's a little bit easier to understand. And if you're interested in any of this, or the idea of looking at, say, dementia in terms of years rather than risks, I recently did a video about the difference of almost 13 dementia-free years between people with different midlife vascular risk factors. And if you're interested in watching that, you can watch that right here.